Hi, I'm Lori at UT Southwestern Medical Center. Thank you for joining us today. We're going to be chatting with pediatrician Christy Turer about childhood obesity. So be sure to enter your questions in the comments field. Before we start, we'd like to thank Children's Health and Parkland Hospital for their support. And we'd also like to remind everyone that Dr. Turer cannot comment on individual cases due to patient privacy laws. As usual, don't forget to like and share the conversation and share your questions in the comments section like I just mentioned. We'll take just as many questions as we can get to in the next 30 minutes. So let's start off with something just to kind of set the big picture for ourselves, Dr. Turer. How about telling us a bit about how common is childhood obesity and why is this issue so important?
Yes, so currently the rate of childhood overweight and obesity among U.S. children is 3 out of 10 children, and rates worldwide have increased tenfold, affecting now 124 million children worldwide.
That's incredible. Why is this an important thing for us to be paying attention to?
Because having overweight and obesity impacts health, heart health, as well as joint health. Sometimes not during the period of childhood, but in young adulthood.
I see. So the effects can come later.
Mm-hmm.
All right, well, let's hear a little bit about what is the difference between being overweight and being obese.
Okay, so childhood overweight and obesity are defined by the health of one's weight for their height. And to measure that, we use a measure called body mass index, or BMI. And in children, it's indexed by using percentiles for age and for sex. And so for both girls and for boys, a BMI percentile that's at or above the 85th, but below the 95th is considered overweight. And a BMI percentile at or above the 95th percentile is consistent with obesity.
I see. So there's an actual chart that tells you specifically for your age and your height.
Right. And parents can calculate that for their children by going online, and the Center for Disease Control has a BMI calculator that you can use to determine your child's BMI percentile.
So are there steps, speaking of parents, this is spring break for a lot of parents and probably next week for other parents. So are there any steps that parents can be taking to help their children achieve a healthy lifestyle?
Yes, absolutely.
Okay, let's hear.
The number one thing that parents can do is look at their own health and healthy lifestyle specifically, so their diet and their lifestyle, because more than anything we say, our children emulate what we do. So the very most important thing that we can do is consider our role as role models, and are we maintaining healthy lifestyles?
Okay. And what are some examples of a healthy lifestyle that you can tell us?
So, from a variety of things, I think a lot of people talk about diet and lifestyle. I also think it's important for adults to think about their use of technology. So using screens, using computers, watching TV, sedentary time, you're not using your body, you're not expending much energy. There's in fact one study that suggests when we're playing video games, we use less glucose, expend less energy than when we're asleep. So taking a nap rather than playing a video game, you'll burn more calories.
Actually more productive.
Technology use is an underappreciated area for adults. We counsel kids all the time, but I think we increasingly need to talk about our use of technology around our children. So do we have the phones at the dinner table? Are we having family meals? Are we turning off the TV? For children, we recommend no more than 1 hour of screen for kids who are 2 years of age up to 5 years, 0 minutes of screen time for those under the age of 2, and then 5 and above, 2 hours a day. How many adults are spending under 2 hours a day between telephones, tablets, television screens, and the like?
Oh my goodness, that definitely is thought-provoking. Yes, as well as the role model aspect that you mentioned. Yeah.
And sleep is another underappreciated aspect. So how many parents are staying up late watching late night TV or watching TV into the evening or using their computers rather than sleeping, because sleep can affect appetite. It can affect not just energy expenditure, but the amount of energy our bodies absorb from the food that we take in.
I didn't know that.
Yes.
That's really interesting.
Yes.
Okay.
And that was per data from Laura Hooper's group. She published in Science on this, that sleep deprivation can impact absorption of fat from the gut.
Okay.
So making sure that children are getting plenty of sleep, going to bed early, and that parents are as well, and are role modeling getting sufficient sleep.
All right, thank you. Well, we're starting to get some questions in, so let's take one of the first ones from Mary. She says, I thought BMI wasn't completely accurate as it doesn't take into account muscle. Is that not true?
Well, it does take into account muscle, although certain people who have more muscle mass, it cannot correctly reflect the amount of adiposity. So body mass index is supposed to reflect the amount of body fat. But in certain individuals who have more muscle mass, for the same BMI, they may have lower body fat compared to somebody else. So yes, it can be less accurate in that regard, and that's typically for boys. And we can talk about some other ways to think about the health of BMI beyond just that measure, because I agree there are certain instances where it can be less accurate than we'd like.
I understand, yeah. That is the best tool we have right now.
Correct.
I imagine. Okay.
It's the best tool.
Okay. So we have another question from Sierra, and she would like to know what is causing this trend of childhood obesity?
So a lot of things are causing this trend, and I like to group them into things that are modifiable and things that are not modifiable. So not modifiable would be genes, and then other things that are hereditary, something called epigenetics can occur, and even the influence of maternal BMI when the infant is in the womb developing can affect a child's risk. And then there are modifiable things, some of the things that we were just talking about: technology, sleep, diet, lifestyle, medications that we as physicians are prescribing people that affect appetite, as well as societally, right? If you think about when you go to a movie, the size of the popcorn, the size of the drinks, they're larger. Restaurants, the portion sizes are larger. So there are also some societal causes that to a certain extent are modifiable. They're not without considerable energy expended.
Very interesting. I know we've all seen those big buckets of popcorn at the movies.
Yes, yes. And the Slurpees, they're huge.
Yes, yes, that's a really interesting point. Well, let's see. We have another question from Mary. She says, my kiddo doesn't like vegetables. You've probably heard that before.
Yes.
Any tips on how to get him to try more vegetables?
Yes. There are a lot of resources out there. You can look at, how to hide the vegetables. We, in our household, and this is not evidence-based necessarily, but we talk about good choices and bad choices, right? And we know that vegetables are incredibly important for the health of one's guts, as well as they're associated with longevity of life, so in length of life,
yes,
right? And so for all those reasons, it really encouraging your child to even just eat a bite if you can. Your role as a parent is to provide, but allow the child to decide. So I wouldn't necessarily force their hand, but really talking with them about making good choices for themselves, because the majority of the choices our children make are in our absence. And so I offer my children that choice to always have vegetables, so I put it on their plate. That's my role, is putting it on their plate. Their role as children is whether to accept that or not. And so it's up to you as a parent if you want to hide them in things, or if you just want to talk with them about making good choices. At the end of the day, it is good to get your children eating vegetables. I absolutely encourage that, but it's a great challenge. I've got a couple of kids who really fight me on it, but they do eat them, and we talk with them about choices, and that's the way that I have them make those selections.
Right. That's some great advice from one who's been there in more than one way. Well, you mentioned something about choices when kids are not with their parents. And there was a question that came in about how can parents what suggestions do you have for parents to help their children keep a healthy lifestyle even when they're, for example, at school or other activities?
Right.
Yeah.
And again, it comes to, what I teach my children is when you make good choices, it opens doors. And it also makes your body feel good. So I love when my son's been watching TV for like an hour on a Saturday morning. What did you learn? Frequently, he's just kind of, tuned out, right? But then you take him outside after he's played soccer and he's had a great time. And at the end of the day, we always ask, what was the best part of your day? And it's always whatever activity we did. So we use that to reinforce, how does it make your body feel? So if you're at a party where there's tons of snacks and fruit punch, where is the child happiest? Is it eating the snacks or is it dancing with the friends? So frequently, it's actually the social interactions that bring the most joy. And that's what our lives should be about. It shouldn't be about prescribing, a calorie-restricted diet or something, but really enhancing joy and meaning and, really putting food in that aspect. So I really try to get families to find what they love, find the activities that they love, and encourage their children to do that. And when they're at school, to make good choices for themselves and role model good choices at home by providing a healthy, food environment, activity environment, and then following up by asking questions about, what did you do today that really made you feel strong and healthy? Right? And
interesting.
Allowing them both to talk with you about the maybe not so good choices as well as the good choices, so that they can grow and learn and make good choices going forward.
Excellent. Well, we've got more questions coming in, and I just want to pause and remind everyone to put your questions in the comments section. And we are actually about halfway through, so we still have plenty of time to take questions. And here's one from Sierra, who would like to know what's the difference between being overweight and being obese. How are those related?
Well, so first of all, Sierra, I think it's really important that we use the terms overweight and obesity, not to describe a child as overweight, but meeting criteria for overweight. These are diseases, they are conditions, they are reversible, but I think it's very important to not label children as such.
Okay.
The difference really, there's a difference in definition, which has to do with the magnitude that one's weight is above the healthy range for their height in terms of that body mass index percentile. And the overweight, again, is at the 85th, and obesity is at the 95th. But I think the more important piece is really what those numbers mean for health. So we know that children at the 85th, but below the 95th, as young as toddlers, already have 1 to 2 risk factors for heart disease. Even as toddlers. Yes.
Really?
And the children who are at the 95th, so they meet criteria for obesity, they are more likely to have 3 or more risk factors for heart disease. And it doesn't stop there. I mean, we're starting to see joint problems. I've got 20 to 30-year-old patients. I'm also an internist. I'm dual-trained internist and pediatrician. I have patients in their 20s to 30s who are needing knee replacements and hip replacements that young.
Wow, that's really telling. Yeah.
So it's very important that we understand sometimes the complications are not seen when they're children, but it's not far into adulthood that we're starting to see these things.
Right.
And so when we're talking about that body mass index percentile, it's not about what a child looks like. It's not about labeling them as overweight or obese. It's not about what the other kids think or what other parents think, or even grandparents, because for grandparents, we're all healthy, right? But it's really about what does your child's weight for their height mean for their health. At the end of the day, that's what matters, is can our children use their gifts? Can they maximize the use of them without the being held back by health problems?
Oh, I understand. Okay, thank you. So we have another question here from Mariah, who would like to know, how does childhood obesity in Texas compare to other states? And are certain ethnicities more prone to have obese children than others?
So we're not number one, even though Texas is number one for a number of other things. Yet we do have some of the higher rates, and I think that is likely attributable to a higher population of Latinos and Hispanics, who we know unfortunately are at much greater risk for overweight and obesity and the health consequences that it brings, both diabetes as well as fatty liver disease. So that can really increase the prevalence in our community compared to the rest of the country. The other thing that can increase rates is poverty. And so in areas in Texas that have poverty, have poor health care coverage, and don't have good safety nets, that can contribute as well. So things that we can do as a community in Texas is to really support one another. You know, I'd love to see the Latino community really coming around health, and I've seen this at times through different organizations and stuff, and I love that. I think we need to create these social movements, and then also on a state level, the policies that allow the safety nets to support these families and these children in developing healthy habits, healthy lifestyles, and healthy homes.
Well, we're certainly getting the message that it starts early in life and that there's a lot that can be done from everything that you're saying. You mentioned something about medications earlier, and we were chatting just before the chat began. And are there medications that can impact weight one way or another?
Absolutely.
Okay.
Yes. So there are a number of medicines that we have very good data regarding their impact on weight. Many of them are medicines that we use to treat mental health conditions. So things like bipolar disorder and schizophrenia are treated with antipsychotics. There's very clear evidence that those drugs cause profound weight gain. As one example, there was frequently the trials that are done are short-term, 6 to 8 weeks. There was one trial in children that was done where they followed them over 2 years, and children prescribed this drug had an average weight gain of 77 pounds over 2 years. 77 pounds.
That's enormous.
So drugs may have an incredible impact in certain children, and that's a critical thing to ask your child's pediatrician. If your child's on medicines or they're recommending a medicine, is asking, is anything known about the impact of this medicine on weight? So mental health drugs, both, there's certain antidepressants that do it, antipsychotics certainly do it, and there are a number of other medicines that we know, although we need better data, and this is something I'm investigating right now, is really trying to get high quality data to figure out what we know for both children and for adults about some of the lesser known drugs that impact appetite at a minimum and weight potentially. More to come.
Very interesting. I think that could be another conversation with you later on. Yeah. Okay, so let's talk about physical activity. I bet you have some tips for parents on ways to help their kids get active, and maybe there's some ways to do that as a family.
Absolutely.
Yeah.
Yes. Well, and it doesn't have to always take the form that we think about, which is like signing up for a gym and going to a gym.
Right.
I care for a lot of families who don't have means, or the families, the parents are working 3 jobs. So what do they do, right? If they can't get access to, let's say, a YMCA or a gym. And there are some very simple things. I mean, if you've got music downloaded to your phone, play music while you're getting ready in the morning and have your children dance. We have a policy that anytime the kids are watching a TV program and a song comes on, they're to get up and dance and move and have fun with it.
That sounds fun.
Yeah, and when I am making dinner, or my partner's making dinner, we turn on music and have the kids dance while we're doing that. And it's fun. It doesn't feel like work. It feels like fun, and I think it promotes joy, and that's important.
Great.
And then the other thing for parents, I was mentioning I write a lot of grants and papers, so I sit at a desk all day. And if you can get things that help you to be active in whatever it is that you're doing, for me, sitting at a desk, what can you do to be active sitting at a desk?
Right.
You can get an under-desk cycle and put a stepper on your shoe so that you can accumulate steps, but also do a better job at your work. So you can create a win-win. So I don't think it has to be the typical go to the gym. Think outside the box. What are some activity things you can do that are within your existing family flow, workflow, day flow?
That sounds fun, actually. You're making it sound fun. So we've got about 10 more minutes left for questions, and we've got a couple of new ones here. Here's one from Eric. He'd like to know, is there a link to decreased vitamin D deficiency and obesity in children?
Yes, so I published on this in 2013 in the Journal of Pediatrics, and there's a remarkable increased prevalence of vitamin D deficiency among children with overweight and obesity, and it differs by race ethnicity. So for example, children who are African American and have severe obesity, 90% have vitamin D deficiency. So the test, when we run it at a typical lab, costs $100. And that, to me, if you've got a 90% prevalence in a population, says we need to treat. So those children, when I see them in the clinic, I say, I want you on vitamin D. And so you can check out that article. I'd be happy to let people know.
Yeah, we can link to it here. Certainly. After the chat. We can share a link.
Yeah. But then the more important thing, too, is what did that vitamin D deficiency mean for your children's health? And the answer to that is not well known, and I couldn't examine it in the data set that I was using. We believe that the most important reason to have sufficient levels of vitamin D is for bone health. So, and we know that children with overweight and obesity are more likely to fracture in areas that are associated with vitamin D deficiency, like in the wrists and in the ankles and in the feet. And so that may be one reason that it's important to have sufficient vitamin D. And then another one is, other bone-related things, and then people talk about the cardiovascular health related items, so blood pressure, hypertension is associated with low vitamin D levels, and there's some data that vitamin D deficiency is implicated in diabetes. Though when they've actually prescribed vitamin D and looked at its impact on levels of glucose control, those data have been mixed. So I think that the best data really are for bone health.
Okay. Well, it sounds like overall vitamin D is a good idea.
Absolutely, yes. And it's very prevalent as well in the Latino community. So both African Americans, they have the highest rate, and Latinos the second highest rate. And for children with overweight, obesity, and then there are gradations of obesity, and the severest level of obesity, they have the absolute highest rates.
Very interesting. Well, thank you for your question, Eric. That was a really interesting one. And here's an interesting one from Mariah. Are there any public health programs available in DFW for the population to inform and prevent childhood obesity for those in poor neighborhoods or food deserts?
Yes, absolutely. So there's a program through YMCA that is called MEND, and that is one resource. Another one, you might ask your child's primary care provider if they know of local programs. There are different local programs. Parkland has one. They have the Heroes program. And then our Children's Health Group runs a program called Get Up and Go, and they can link families into YMCA and get the whole family a membership to YMCA, which can be really nice because particularly the YMCA's with pools, for children who struggle with severe obesity, the pool's a fantastic place to get exercise because it takes all the pressure off your joints. You can have fun, you can move, you can dance in the water.
Splash people.
Yes. So pools are wonderful, wonderful.
That's great, and that's a good recommendation for Texas coming up to the summer, that's for sure.
Yes.
Let's talk a little bit about future health risks. So we know obesity makes a lot of things difficult for children, and we've been talking about a little bit about their self-esteem and bullying and that sort of thing, but what happens later in life if you've been obese as a child? What kind of risks do you have?
Right, so we know that overweight and obesity alone can impact the likelihood for developing heart failure, stroke, heart attacks, and death. And we are starting to see these earlier, unfortunately. We know that there's been a
Yes.
50% rise in heart failure incidence in 20 to 35-year-olds. There has been an 8-fold increased risk of kidney failure and a marked increase in stroke. And all of these have been associated with overweight and obesity, even in childhood. So it's very important to understand, besides overweight and obesity, what are the other things that may be contributing? That's where less is known. So for example, is it high blood pressure in childhood? Could we modify that risk? Even if we can't get a child to improve their weight, we can get their blood pressure down. Does that reduce their stroke risk, their kidney failure risk, etc.? So that's what's lesser known and something that I think is incredibly important to figure out. And for parents to understand that, yes, we need to treat overweight and obesity. We also need to make sure that we're checking children in primary care for high blood pressure, high cholesterol, any evidence of prediabetes or diabetes, and treating those early while working on lifestyle modification and examining whether the child's on medicines that impact their weight.
Wow, that's a huge consequence that maybe people don't think of immediately, but it comes in the longer term.
Yes.
Yes. Okay. If you have any further questions, we're just about to wrap up. We just have a couple more minutes left. Is there anything else that you would like to add, Dr. Turer, about your work? Because I know you're doing a great deal of research in this area right now. Anything you'd like to share?
Well, so my work is really on the role of the pediatrician. What can we do as providers? And not just the pediatrician, also the internist, although my research right now is really focused on pediatrics. And so I really encourage families to not, if your child's pediatrician talks with you about your child being at an unhealthy weight for their height, really ask them, is it impacting my child's blood pressure? Would it be indicated to check for high cholesterol or evidence of prediabetes or diabetes? And that can help inform if your child needs treatment for those while you're making some diet and lifestyle modification changes to your family. I like to talk about both of those and also to really talk about, it's about the health. It's not about labeling your child. And I think that's really important. And even when there's a strong family history, there's a huge genetic component, there are still some modifiable things that we can do. So I think that's really important, that we need to be more focused on health. And then, when we're talking about children, I agree with not labeling them, talking about overweight or obesity. But again, framing it around health and then really playing to the child's strengths. Make sure you tell your pediatrician what you love about your child and how you can increase more of that, right? So they can use their gifts, so that it doesn't get too medicalized. After all, each of these children are just beautiful and unique. So I think that aspect needs to be infused more in our conversations about healthy lifestyle, is just the children's gifts and their strengths and how we can build on them when we're making these lifestyle changes.
That's really beautiful. Thank you for sharing that. We do have one final question, and I do think this is a great one considering we've all been through the flu season this year. The cold and flu season has been especially tough for many people. And this question is from Mariah. She says, does obesity affect susceptibility to infectious diseases? Does that make it more likely for you to get sick?
So the answer is probably yes. We know that particularly children with overweight and obesity are more likely, if they get the flu, to be hospitalized from the flu and to die from the flu. So it's incredibly important these children get vaccinated for influenza. And we know at very high levels of obesity, when there's a lot of inflammation, it can impact especially natural killer activity in parts of your immune system, right? So it's affecting the soldiers in your blood that are helping you fight infections. And we know from data in Great Britain that the most common reasons that children are visiting their general practitioners there is for infections. it's for ear infections, it's for strep pharyngitis.
Okay.
And so because they are likely more susceptible to all sorts of infections, not just flu. And so, in fact, when I've seen children improve their weight over time, the number of urgent care visits for infections, at least by observation, I don't have data to back this up yet, appears to go down. And I'll share that with parents. I'll say, it does appear she's getting healthier. So
it's a win-win.
Yes, although we need more data.
Okay, well, final question, and this is from Alexis, and thank you for asking this because you were speaking a moment ago about what things you could get your children checked for at the pediatrician, like their blood pressure, et cetera.
Yes.
And she'd like to know at what age should parents begin asking for those types of tests?
Well,
that's a great question.
Right. and our guidelines differ. Actually, this has been a source of some frustration.
Okay.
So, blood pressure we start to measure in all children at the age of 3, except for certain children. So for children under 3, you might check blood pressure a little earlier if your child was born early. Children who were born preterm, really before like 36 weeks, and then also who were born with what's called intrauterine growth restriction. Those children are more likely to have high blood pressure irrespective of body mass index. Okay. And so those children perhaps should have their blood pressure measured a little earlier. And then if they have overweight and obesity between 2 and 5, our weight management guidelines actually do recommend that they get screened for high cholesterol, fatty liver disease. And then blood sugar and risk for diabetes, we assess using just a skin exam to look for darkening at the back of the neck or on the face or different parts of the body, which is called acanthosis, prior even to puberty. But it isn't until a child is 10 that we're recommended to start screening for diabetes using certain blood tests.
I see. Okay. All right. Well, it's been so informative and interesting talking with you, Dr. Turer. Thank you for all this great information. And thank you all for joining us, and have a great day. Thank you.